going to be talking about chemotherapy-induced peripheral neuropathy, how long it might last, what it consists of, what it looks like, and some ways to consider treating it or getting treatment yourself that doesn't have to do with medication. Before I go on, I'd love to invite you to subscribe to our channel. We put new content out all the time about treatments and how to deal with life and breast cancer at the same time. And I'd also love to invite you to go to Yerbba.com to get your personalized report. Chemotherapy-induced peripheral neuropathy is a big mouthful, but basically what we're referring to is chemotherapy damage to your nerve endings. And the damage primarily occurs to the furthest away peripheral nerves. The reason I'm bringing my fingers together is because it's in the fingertips and the toes that peripheral neuropathy is most pronounced. And it actually develops in what's called a glove and stocking distribution. So it starts at the fingertips and then moves up as the nerve damage becomes more pronounced, more severe. This is one of the most vexing problems from chemotherapy. Some of our best medications are the very ones that cause peripheral neuropathy, specifically the taxanes like paclitaxel. You may want to check out our video on Taxol or paclitaxel. The other medications that can cause this are cisplatin, which we use sometimes in triple-negative breast cancer, and sometimes the vinca alkaloids like vincristine or vinorelbine. Vinorelbine is used in the treatment of some breast cancers. Peripheral neuropathy, as I mentioned, starts in the fingertips and the toes and gradually moves upward. Most common symptoms are numbness and tingling. Your nerves are the things that transmit electricity through your body, sensation, and peripheral neuropathy can also cause pain or aching. There's a sensation described as a painful numbness that can happen with peripheral neuropathy, which has always struck us as strange that you can have both numbness and pain, but that's exactly what it is. You'll notice this usually shortly after receiving chemotherapy, and it can become worse with each cycle, and it tends to get better before the next cycle. So the typical pattern is it starts maybe with the third cycle, and it's gone by the time you come in for your fourth cycle. If it's persistent, I'll be addressing that in just a moment. If it's persistent, we try not to give you the next chemotherapy cycle. We wait until it's better. And how much better does it have to be? Well, the thing that I recommend using is, can you button small buttons? If you can't, then it's more severe and more persistent. Can you pick a small coin up off a desk without sliding the coin to the edge of the desk and picking it up? Rather, can you pick it up with just your fingers? So those sorts of impairments are a sign that holding off on chemotherapy till it's better, or even switching chemotherapy, is something to talk about with your medical team. There is a coasting phenomenon that we see with drugs like cisplatin and carboplatin. These drugs are the platinum agents. These are metal salts that are taken up into the nerves themselves and then can release the chemotherapy to the nerve endings. What this means, what the coasting phenomenon means, is you can stop chemotherapy and the neuropathy can keep getting worse. With the taxanes alone, with paclitaxel and docetaxel, when we stop the chemotherapy, the healing begins. We tend not to see that coasting phenomenon where it gets worse after treatment. That's not 100% the case, but coasting is very uncommon with the taxanes, whereas it's much more common with cisplatin. The pain that happens with neuropathy can make it really hard to get comfortable at night. So in addition to interfering with activities of daily living, you can feel pain and that painful numbness that makes it hard to sleep. So that can be really difficult. And of course, then you can get really down because you're not sleeping well and you can't do things that are important to you. This is one reason it's really important to talk to your medical team if you develop neuropathy. Now, a lot of people say, I don't want the doctor to stop treatment because I'm reporting these symptoms. And we don't have to stop treatment. We can make modifications in the dose or the schedule, and we can also switch to another drug less likely to cause neuropathy. This is something interesting about neuropathy, as it increases with increasing cycles of treatment and higher doses of treatment. There also appears to be a genetic predisposition. Some newer research is showing that people who have a certain type of gene, this is not something we test with genetic testing. It's very specialized and it's investigational, but there may be people who are more prone to neuropathy than other people. So if you got neuropathy and you're talking to a friend who didn't, it's not your fault, and it's not the fault of the treatment team, your medical team, or even differences in treatment. It just may be how vulnerable you are. So at the top of this video, I asked, how long does it last? So I think I've answered in terms of if it's immediate, tends to get better by the next cycle, and if it doesn't, modifications should be made. If you are left with neuropathy after all of chemotherapy, let's say it's set up early on and it didn't really get better and you're wondering how long it's going to last. Well, this is interesting. The neurons repair at about 1 millimeter per month. So if you think about maybe half an inch, that's a centimeter, that's 10 millimeters. That's 10 months for the nerve endings to regenerate. So if you have a centimeter, your fingertip is numb or your toes are numb, that's going to be close to a year before the neuropathy is better. And there are those of you who are watching who've written to us saying that your neuropathy has persisted years later. That can happen. It's not the typical course, but we see it enough that it's important to recognize that this is a real phenomenon. We're not entirely sure why that happens, but for some people it can take many years to resolve. And for some of you watching, you may be 3 or 4 years out wondering if it will ever go away. My key message for you is not to give up hope. I know of somebody who over 10 years out is finally having improvement in her neuropathy. 10 years out. It was her 10-year anniversary, and she said it's finally gotten better, and her quality of life improved. She was able to go hiking again. So I don't want to give you false hope, but there really is no false hope, is there? Hope is always there for you. So please maintain your hope. Long-term neuropathy tends to improve so slowly you may not even notice it. It's a real thing. Don't let anybody tell you it's not from your chemotherapy. Now, that does make me think there are other things that can cause neuropathy, and we want to be really careful to avoid oncovision. Oncovision is when everybody says, well, that's due to the cancer and its treatment. That's due to the cancer and its treatment. And the risk with that, of course, is that there may be other things that are treatable. And by attributing everything to the cancer and its chemotherapy, you could be missing a reversible, very treatable cause of neuropathy, such as thyroid disease, or vitamin deficiencies, or other underlying medical conditions. So a good question to ask your team is, what other things could be causing neuropathy? Because there are always other things that can be causing a symptom that we have around the time of treatment or that appears afterwards. What are some things you can do? Well, there's some evidence that aerobic exercise, like fast walking or jogging, bicycling, swimming, may help nerves regenerate. Now, if you're tired and having pain when you step on your feet, this can be difficult. So think about tailoring an exercise where you're not hurting the nerves that are symptomatic, but working with somebody in physical therapy or working with an exercise coach, you might be able to find ways to get your heart rate up to moderate levels where you can talk but not sing. That's all you need to know for moderate. If you can sing, you need to increase the intensity, and if you can't talk, you want to go down on it. This does help neuropathy in a recent 2023 study. The other thing that you may find help is acupuncture. Acupuncture may increase blood flow to the nerves, which may help with their healing. It's very hard to do a randomized controlled trial of acupuncture because when we do what's called sham acupuncture compared to really targeted acupuncture, people still benefit. So it's really hard for us to say with the strength of conviction we have with clinical trials of medications, for example, that acupuncture works. It's not covered by insurance, so it's important to work with an acupuncturist where you can afford this, and sometimes health savings accounts and flexible spending accounts will cover the cost of acupuncture. Some clinics, some cancer centers have acupuncture right within them, and those can include acupuncture in the cost of your overall care so you don't have a higher or much higher out-of-pocket cost. What about vitamins? Vitamin B6 and vitamin B12 have both been studied in preventing and treating neuropathy. There's not enough evidence that they work. Some really good studies have been done, and while there may be a signal that they're helping, we can't say for sure with the level of evidence that Yerbba prefers to use. It won't cause you harm, though, as you know, we don't recommend taking high doses of vitamins during chemotherapy. You might want to check out our video on vitamin supplements during chemotherapy if you have more questions about that. I have covered a lot. I hope you're leaving with some hope and some practical things to think about. If you're watching this on behalf of somebody who's going through this, please make sure they know that you understand how difficult and frustrating a side effect this can be. I want to remind you again to go to yerbba.com to learn more about your treatment options. And as always, thank you for watching.